According to the CDC, coronary heart disease is the most common type of heart disease, killing more than 385,000 people annually. Coronary heart disease is a condition in which the coronary arteries become hardened and narrowed. This is caused by a buildup of fatty material called plaque within the artery's walls. There are two main coronary arteries, one here and one here, that branch off to supply blood to the heart muscle called the myocardium. So any defects in the functioning of the coronary arteries is a major problem because it prevents the heart muscle from receiving enough oxygen-rich blood. Not only is the blockage of the coronary arteries a serious problem, but it can cause even more serious problems like a heart attack. Fortunately, there is a way to treat this problem, which is through coronary bypass surgery. It is also called coronary artery bypass graft, or CABG, which represents the acronym CABG. The purpose of coronary bypass surgery is to improve the blood flow to the heart muscle. According to the Mayo Clinic, the surgery also reduces the symptoms of coronary artery disease, improves the quality of life, and prolongs the life of the patient. However, this surgery doesn't cure the problem altogether. Medication and lifestyle change can help prevent any further blockage or damage to the vessels. According to Johns Hopkins Medicine and the Encyclopedia of Surgery, the procedure proceeds in the following manner. First, the patient is given a painkiller and an induction agent to render them unconscious. Then the chest needs to be opened in order for it to be examined. Then the first major step of the surgery can be done, which involves taking an artery or vein from another area of your body. Typically, it is an artery or vein from your leg or arm. Another common artery used is the internal mammary artery located in your chest. After this is done, the patient is given heparin to prevent blood from clotting. Now the heart needs to be stopped in order to move to the second main step of the surgery. To do this, tubes are inserted into the heart so that the blood can be pumped through the body by a machine called cardiopulmonary bypass machine. This machine not only takes over the pumping action of the heart, but also the work of the lungs. Once the machine is working, the heart can be stopped. This involves the aorta being cross-clamped and giving a potassium mixture to the patient, which stops the heart. Now the bypass part of the surgery can begin. The second step of the surgery involves attaching the artery or vein that was taken from another area of the body to the blocked artery. Basically, one end of the self-transplanted vessel is placed on an opening made on the aorta, which is before the blocked artery, and then the other is placed on an opening made just below the area on the blocked artery. So it's able to supply the heart muscle with oxygen-rich blood. So more simply put, the vessel acts as a detour for the blood to go around the blocked area. The heart can now be restarted, and protamine is given to counteract heparin's effect. The chest is finally closed up, and the patient is moved to the ICU to recover. Sometimes there is more than one blocked artery. In this case, each blocked artery will be bypassed in the same manner. According to the Heart and Stroke Foundation, the surgery can take anywhere from 3 to 6 hours, depending on how many bypasses need to be made. Although coronary bypass surgery is a great solution, it sometimes is only a temporary solution since the bypass itself can become blocked. According to the National Heart, Lung, and Blood Institute, this happens in more than 10% of bypass surgeries, but usually after 10 or more years. However, as technology advances, so do surgical procedures, so there are new approaches to this surgery that are minimally invasive. One such approach, which is called totally endoscopic, minimally invasive coronary artery bypass surgery, doesn't require any incisions and has faster recovery time for the patients. However, according to Charles Bryant, for Discovery Fit and Health, there are also some cons to this new technique, which include it being riskier due to how new and complicated the procedure is, and it also causing more stress on the heart. Despite the multiple techniques seen for this surgery, they all basically revolve around the two main steps described earlier: removing the vessel from another area of the body and attaching the vessel to the affected area so that it can act as a bypassing detour for the blood. And they all help to treat the symptoms of coronary artery disease. Hopefully in the near future there will be even more successful, innovative, and permanent ways to treat coronary artery disease. But for now, this procedure seems to be working just fine. In fact, according to the Encyclopedia of Surgery, this procedure is performed on 800,000 people annually, worldwide, with a 95% success rate.